Hello, everyone. Welcome to this presentation of how to incorporate Count the Kicks into your doula practice. I'm so honored and grateful to share this space with you. This presentation is intended to help you educate and empower your clients to use our evidence-based program, Count the Kicks, to improve birth outcomes for parents and babies alike. I want to thank you for taking time out of your busy day to learn more about how you can better support your clients. So I want you to grab some water, a notebook, your laptop, whatever you need to take notes, and we'll dive right in. Before we start here, I want to give you a preview of the content that we'll be covering today. We'll be discussing some topics including stillbirth and birth outcomes. So if at any point this presentation becomes activating for you while watching, please know that you can take a step away at any point. You can pause the video, skip ahead if you need to. I will not be offended, and you can always come back. And with that, let me take a moment to introduce myself. Who am I on your screen? My name is Naya Thomas. I am the Health and Equity Community Engagement Manager um, at Healthy Birthday, the nonprofit that is the creator of the Count the Kicks program. I come from a background as a birth doula and prenatal massage therapist, passionate about maternal health and reproductive health. And I'm so excited to be sharing this information with you. I started my birth work journey 5 years ago from a place of curiosity, but also from a place of wanting to learn more about birth work because a lot of what I'd heard at the time was fear and horror stories about pregnancy. And so, me being a learner, a lifelong learner, wanting to learn as much about pregnancy and reproductive health as possible, I decided to train as a doula. And in that journey, I learned about the rich birthing traditions and practices that were available within the Black and Indigenous community, like granny midwives, and doulas, community doulas, and was so excited to dive deeper and learn more over the next 5 years and to continue that journey within this role as health equity and community engagement manager across multiple cultures and community practices across the nation. And so part of my role here within this position, health equity and community engagement manager, is really making sure that the tools and resources that we provide are valuable and resourceful and community driven within the communities that we serve. And so I really want to make sure these tools, this Count the Kicks information, is joining the care network that you all have created as doulas and birth workers. That is useful for pregnant and expectant parents, right? So as I share this information and you're listening to the information that I'm sharing, if you find anything to be useful or you have questions, please don't hesitate to reach out to me after you watch this recording, and have a conversation with me. Ask for some time on my calendar. I would love, 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 love to talk with you and chat with you to talk about how this information can be useful to you, your clients, and your community members. So please let us dive into the rest of this presentation. So as I stated, I'll be talking about the Count the Kicks program, how you can help your clients monitor their baby's movements, explore the explore the Count the Kicks app and resources, the power of you as doulas, and advocacy and empowerment. So, what is Count the Kicks? Count the Kicks is a campaign developed out of the nonprofit organization called Healthy Birthday. This program, it is highly effective, it's evidence-based, and it is a stillbirth prevention program. It was developed 15 years ago here, based in Iowa, and it is an early warning system for moms and expectant parents. And we have saved lives in 36 states and 5 countries so far. And this program is easy to implement, and it's easy to share with expectant parents during during their pregnancy. So during our time together, during this recorded presentation, you'll learn more about this program and how to share it with the communities that you serve. But let us take a step back and look at the larger conversation of stillbirth and pregnancy in the United States. So when we talk about stillbirth, we're talking about the loss of a baby at or after 20 weeks of pregnancy. So according to CDC, 21,000 babies are lost to stillbirth every year. That is the unfortunate, devastating reality. The annual number of stillbirths far exceeds the top five leading causes of death among children aged 0 to 14 years combined. And that includes unintentional injuries, preterm births, homicides, SIDS, and heart disease. The good news is research indicates that at least 25% of stillbirths are preventable. So that's thousands of lives that could be saved annually. And so that's why I'm here today with you. Fetal movement monitoring, or counting kicks, with our Count the Kicks program has proven to save lives. You can go to the Count the Kicks website and see highlights of powerful baby save stories from 37 states and 6 countries. And we know that thousands of lives can be saved each year just with improved education around stillbirth and kit counting. So on your screen here, you'll see the impact of stillbirth in communities across the nation. And this is 2022 data from CDC. You'll see that 1 in 177 US pregnancies have a chance of experiencing stillbirth. So that's 1 in 97 Native Hawaiian or other Pacific Islanders, 1 in 100 Black pregnancies, 1 in 139 Indigenous pregnancies, 1 in 216 Hispanic pregnancies, 1 in 223 white pregnancies, and 1 in 270 Asian pregnancies. Now, these numbers tell a much deeper story than what the data reflects, right? We know that barriers to healthcare access are real, and so are the rich birth practices and traditions that stand in the gap. So that is community doulas like you, who might be on the call or recording, sorry, granny midwives, and birth workers. And so when we look at these numbers that are on your screen, I share these numbers to give us a direction on where more support, connection, and tools are needed to continue to close these gaps. These numbers are not inevitable. And I am so proud to say that myself, this organization, we are honored to be a part of the change alongside birth workers and doulas just like you. It's important that we have these conversations and we continue to have these conversations about how stillbirth impacts the communities that we serve, both the communities on the slide before and in low-risk pregnancies, as well as high-risk pregnancies, in settings where there might not be access to birthing facilities, in rural areas, within communities or pregnancies in women aged 40 to 44. Because these are communities that might face and do face a higher risk of experiencing stillbirth. And again, give us a direction of where more resources and tools and information is needed. And that is where you come in, and that's where we're looking to bridge the gap. So, how do we bridge this gap? We bridge this gap with fetal movement monitoring, and that is kick counting, count the kicks, the evidence-based stillbirth prevention program. And this evidence-based program, just so you're aware of context and research, has reduced 32% um, of stillbirths in Iowa in the first 10 years that it has launched. And specifically, in the African American community, by 39% within the first 5 years of the program. So this Count the Kicks program is an example of a health promotion program that can help states, communities, organizations, groups, coalitions really utilize education, resources, initiatives to reduce stillbirth and save lives. So what I'm basically trying to say is that movement matters. So it's important that you help your clients to start counting their baby's movements. So when do we start counting movements? So we start counting movements in the third trimester. So that's at 26 to 28 weeks. So ACOG recommends counting at 28 weeks gestation or 26 weeks if considered high risk or pregnant with multiples. And this is when research indicates baby has established a consistent pattern that mom can feel expectant, sorry, mom or expectant parent can feel and track the movements. And movements really can look and feel multiple different ways. So that can be rolls, kicks, jabs, swishes, pushes. These all count as movements. The only thing we really don't consider a movement is a hiccup. And that's because a hiccup is considered an involuntary movement. So when we think about when we hiccup, we can't really control when we hiccup, right? As much as we really want to control when we hiccup, we can't control it. And so we don't count those as a movement when we are tracking baby's movement. So when you're guiding your client through how to count their baby's movement, you want to start step by step, break it down step by step. And the first step is going to be, what's the best way, the most accessible way for your client to track their baby's movements? Is it going to be using the mobile app? Is it going to be using the web-based app? Is it going to be using a paper chart counting app? We have multiple ways that your client can use a system for counting their baby's movements. So that's the first step. Two is making sure they're counting their baby's movements every single day. That's that consistency bit. Every single day, they want to count their baby's movement and select a time that their baby is most active. So whether that's 9 a.m. in the morning or even right before they go to bed. So if their baby's usually doing jabs and pushes and kicks right as they're falling asleep, they can pull out their phone real quick, hit the app and say, okay, let me count baby's movements right before I go to bed. Okay? And then they're going to time how long it takes their baby to get to 10 movements. And they're going to rate the strength of those movements, whether it's going to be light, fluttery movements or really intense movements. And that's going to be really important because we're determining what's normal for their baby. And so after a few days, you'll start to see an average length of time it takes to reach those 10 movements. And again, this is establishing a pattern of what's normal, what's that data that we're gathering, right? Consistency, a pattern of data for your client and for their baby. And so what I really want you to emphasize with your client as you're laying out these steps is some babies may take 4 minutes to get to 10 movements, and some babies may take 30 minutes to get to 10 movements. What's normal for their baby is what's normal for their baby. There's no reason to compare to maybe a previous pregnancy or another like a friend's pregnancy or something else, right? Every baby is going to be different, and that's completely okay. So please, please, please really emphasize that to your clients. And so if or once you've established what's normal for their baby, you can then find out what is not normal for their baby. And so when you find maybe there's a change in intensity or a change in count, they can call their provider right away if they notice a change in strength of movement or how many times or how long it takes to get to those 10 movements. So let's go into the app and see what that looks like to really track those movements as we get into it. So this is the Hallmark tool that I was talking about, the Count the Kicks app, and it's available in 20 plus languages: English, French, Hebrew, Hindi, Portuguese, Spanish, Somali, Russian, Vietnamese. The key here is we wanted to make it as accessible as possible for as many folks as possible. And so it is available in 20 plus languages in over 140 countries. And so here's how it works. So again, every day starting in that third trimester, we want parents to count their baby's movements. We want them to choose a time of day that their baby's most active and to continue to count around the same time each day. So encourage your clients, please, to register so they can continue to get all their data history as they're monitoring their baby's movements. And so when they sit down and they're focusing on their baby's movements and paying attention and listening, they can tap this teal foot, and it sets a timer that starts, and they feel their baby move, push, kick, and after they get to 10 movements, the timer stops, and the app asks the user to rate the strength of their movement. And research shows that not only should we be paying attention to how long it takes, but the strength, right? So once they rate the strength of the movement, the app shows a graph. Oh, let me pause here. This is the strength that I was talking about just a second ago. So fluttery and then fierce. Fluttery is the light, level 1, and fierce is the most intense, level 5. And so once they rate the strength of those movements, the app shows a graph, and you can add some additional notes there. The app will show a graph, a visual representation of how the baby has been moving, and you can see it here. And this is the history. Oops, I might be missing a beat. Oh, there it is. You see a graph. There we go. So you'll see this, the app shows a graph, and this is a visual representation of how baby has been moving. And it's in this pink and red here. And so this is a trend line of how long it takes the baby to get to 10 movements. And so think of this as a data download of your client's intuition. So they can download this data and they can share it with their provider or other people, right? So this is a visual representation of what they have been monitoring as they've been bonding with their baby, and monitoring their baby's movements. And so some other features I just wanted to flag is that this can be, you're able to count for single babies or twins. There's daily reminders on here. There's free resources where the user can enter their zip code and get access to free and low-cost resources such as food banks and childcare assistance as well. There's also an opportunity to have get access to a contraction timer, as well as a way to manually scan a paper chart into the app, as well as digital badges to encourage daily use on the app as well. So remember, if you or your client doesn't have access to a mobile device, you can always do this on a downloadable Kick chart from our website as well. So this is not the only option. This is just if your client prefers the mobile app. Another feature within the app and also on our website that I wanted to highlight that's great for clients and you as well as doulas is our Ask Anna feature, which is a responsible AI generated assistant that provides instant responses to questions about baby's movement, um, and provides additional autonomy and advocacy for expectant parents to use the free kick counting app. So Ask Anna really is this place to ask anything about pregnancy. So it's better than Dr. Google, Dr. TikTok, all of that, because it is providing answers from our medical advisory board. So it's evidence-based answers with uh, answers answers that are readily available and instantly available for your clients around pregnancy and kick counting. Another thing I wanted to add here is that we have free resources available within the app that have information that is specific to zip codes. So access to free or reduced cost services, um, like dental care, diaper banks, WIC clinics, and anything that would be um, needed and easily accessible for prenatal services. So this is an awesome resource to provide and include within your birth plan or within the birth plan for your client as well. You can also access it on the website at healthybirthday.findhelp.com. Additionally, there's educational materials that you can access as a doula from our website, available in multiple languages, as well as at a glance materials that are visual based materials for maybe your clients who prefer to look at materials that aren't super text heavy, as well as some wristbands and badge reels depending on what state you're in. A lot of these materials are free or low cost depending on your state. And if you scan that QR code from your phone, or go to counttthekicks.org, you can access all of those materials as a way to share with your community, your doula collectives or coalitions as well. Additionally, on our website, we have digital resources available to you as a way to share education and continue to share education with expectant parents, similar to that 5-step information that I shared earlier as a quick reference guide and a reminder for parents as well. That's available in 17 languages. Okay, let's take a beat. Phew! We got through a lot of information there. A lot of information. Let's take a moment. Opportunities for you to empower and educate your clients. So one opportunity is to address common concerns or misconceptions. So one opportunity, or I should say, part of your role in in being a doula is definitely empowering and educating, but also addressing concerns that might come up throughout their pregnancy, like misconceptions. But you can do that through sharing accurate and supportive information. And so when it comes to stillbirth and counting fetal movements, some common misconceptions may come up. Let's take a closer look at 2 or 3 or 4 or 5. There's a few actually that might come up in conversation as you share some of this education and resources. So some of the ones that we've heard as we've shared information are: 1, my baby is always active, so I don't need to count kicks. So that is actually false. Active babies can experience distress, so it is important to continue tracking your baby's movements daily to take the guesswork out of knowing if normally active babies have slowed down. So Count the Kicks gives you real data to show your healthcare provider if you have a concern. So whether baby is always active really isn't a determining factor on whether you should count kicks or not. The important part is really making sure you're counting kicks consistently throughout the pregnancy. That way, if something is out of the norm, you can let your provider know right away. The next one is only those experiencing a high-risk pregnancy should pay attention to their baby's movements. As I addressed earlier in the presentation, all expectant parents should be educated on count the kicks and get to know what's normal for their baby. Both low risk and high risk pregnancies, unfortunately, are at risk of experiencing stillbirth. So it's really important, not only one, count counting kicks is one really important way to bond with baby, but two, um, is really an important way to track baby's movements, both for the health of baby and the health of mom as well, mom and expectant parent. So really, whether the expectant parent is low risk or high risk, it's really important to monitor baby's movement. There is that research that I shared earlier that ACOG recommends monitoring baby's movement at 26 weeks or 28 weeks. That's the only distinction that's made. But otherwise, it really is important no matter whether expectant parents, high risk or low risk, everyone should be monitoring baby's movement. My baby should get 10 kicks in 2 hours. So this one's outdated information as well. Every baby is different, right? Remember what I said earlier? What's normal for one baby is going to be different for another baby. And so it's really important to have that consistent tracking in place so you understand what's normal for that specific client's baby. Current research indicates moms should work to understand the normal amount of time for each baby, so that we can decide and figure out what's irregular movement, and so you can notify provider right away. A few more here. If baby isn't moving, I should drink something cold or eat something sugary to get baby moving. So kick counts are best monitored without interventions like juice, candy, etc. So what we advise, if baby isn't moving like normal, parents should speak up to their provider right away. That is the best thing to do when baby isn't moving. Things like sugary drinks are not advised to get baby moving. The best course of action is to reach out to provider right away. The next misconception, babies kick less near the end of pregnancy. So something you might hear often is that babies run out of room towards the end of the pregnancy. And it's actually what's actually the case is that the types of movements change. So there might be more jabs and fewer rolls. But babies should move up to and even during labor. So if an expectant parent is monitoring their baby's movement at the same time each day, it should take about the same amount of time to feel 10 movements. And so it's really important to continue to excuse me, to continue monitoring baby's movement up until labor as well. And this last one here is I can just use a Doppler device to monitor my baby's well-being. We really do recommend only monitoring or using a Doppler device under the guidance of a healthcare provider. We do not advise using a Doppler device individually by yourself. A change of the baby's heartbeat is one of the last things that occurs when a baby's in distress. And so really we ask you and advise you to follow the guidance of your medical and healthcare provider when it comes to monitoring your baby's well-being. Okay? So when it comes to your role as a doula and incorporating kick counting into your practice, what are some other things that you can do? Great question. I'm so glad you asked. So, taking all of the information that you heard earlier, you can incorporate the kick counting materials, the app, and everything that I shared into your prenatal appointments. You can share it as a part of the birth plan, encouraging your client to start monitoring their movements within that third trimester, emphasizing that it's a way to bond with their baby, identify potential concerns. Introduce Count the Kicks as a method, either through the app or tracking with a paper chart or on the website. And really establishing a pattern. You can get the materials like the brochures or downloading some digital education materials as well. But really making sure that you're personalizing that information for them and establishing a way to monitor their baby's unique movements and reinforcing that changes really could be an important signal for them in their pregnancy. And that's why it's important to develop that pattern and that data within the app or some sort of tracking method so that they can notify their provider right away, right? You also want to reassure them that and normalize that babies have periods of rest, but also stress that significant or persistent change in movement warrant contacting their healthcare provider. So, another part of kick counting, as a part of birth prep and prenatal meetings, is during the follow-up meetings, asking your clients about their experience with kick counting and just checking in, offering tips for integrating it into their daily routine, whether it be maybe while brushing their teeth or reading to their children and incorporating it with another child or sibling or with a partner or family member, auntie, uncle, grandma, whoever, or as a mindfulness practice like deep breathing or in quiet observation, things like that, whatever makes most sense for their lifestyle and their life. And lastly, making sure that you're able to incorporate this as a way to bridge a gap between your client and their providers as well, reinforcing that it's important to share any concerns about kick counting with their healthcare provider and encouraging them to advocate for clinical conversations, helping them prepare questions or concerns about kick counting. And if they do have any concerns or feel unheard, encouraging them to ask for a second opinion. Additionally, all the information that we're sharing today on our website, within the app, all of that is free, and we want you to share that widely with your community and within your doula network. So please, please, please feel free to share this video, digital doula guide, and all this information with your community, with your clients, and with everyone. We want you to share this information so that we can save lives across the country and around the world. Look out for training and information, and share what you've learned with others. Be encouraged to make this information adaptable for your clients' needs, whether it be making sure to select a language that your client speaks, or using some of our more visually based materials or information, adapting it specific to their culture. We make sure and we want to make sure that our information is fully adaptable. And I encourage you to take advantage of some of those things that we have offered as far as language and accessibility as well. And again, encourage consistency with daily practice by incorporating family members and community members into the kick counting practice with your clients. If you're watching this, you're probably already aware of a doula's guide to count the kicks, but if you're not, please know that there's some quick tips and tricks as a quick reference guide in the doula's guide to count the kicks. We encourage you to download it from our digital education resources on our Count the Kicks website. This video is also available within that digital guide to count the kicks. This is especially for you if you're looking for a quick reference guide with any questions. And it's available for you to share, and it's free. It's just for you. It's as a thank you for all that you do for expectant parents within your community. So thank you very much. And as I wrap up here, I just wanted to share this powerful success story from Destiny and Sonara about how she incorporated Count the Kicks into her pregnancy journey and what that looked like. So without further ado, Destiny and Sonara's story.
I am so thankful she got here safely. I hadn't felt her kick all day, but what I did feel was hiccups. And I'm like, okay, Destiny, she's alive because I can feel her hiccuping, but I don't know. In my head, I'm just like, something's just not right. It gave me a guide for something that I could do this time. I'm so glad I counted my baby kicks because if I didn't, they were telling me that I probably would have lost her just like my first child if I didn't go in the night I did. Count the kicks just I mean it helped. It really did. It saved my baby's life. It really did.
Okay. Oh, I get so much gratitude and warm and fuzzies when I listen to Destiny's and Sonara's story. Um, and I hope you do too, to understand the reality of how much the education and resources can make a difference in the lives of families. So thank you. Thank you for listening to this presentation. Thank you for taking time to learn more about the Count the Kicks program and how to support the families that you are serving. If you have any questions at all, please do not hesitate to reach out. That is sincere from my heart. I would love to talk with you, speak with you, learn from you, um, and support you however I can. Thank you so much and happy counting. I hope you have a great day.